Welcome again to the webinar today. We're excited to get to share a little bit more about pediatric telemedicine workflows from a practice manager's perspective. Angie Connors is the Chief Operating Officer and a co-founder at Anytime Pediatrics, and she's going to be presenting this webinar alongside Leslie Baker, the Executive Vice President of Operations at Allied Physicians Group. Hi, Angie. Hi, Leslie.
Tencel, thank you.
Hi, Tencel, thank you.
Well, we are really excited to have you guys join us today. You know, the goal of this webinar today really is to share. So it's been a crazy ride for the last 12 months in telehealth. You know, everybody's learned a lot, and I just think this is a great opportunity for us to kind of share what we've learned. It's a really open forum, so we do have an amazing group of panelists here today. And we've got some questions teed up, but we really want this to be interactive and something that you guys ask questions and hopefully learn from. And if you've got some experience you can share that might help the group, we'd love to hear from you too. So I think the first thing we'll do is just kind of go around our group and ask our different practices to introduce themselves and, you know, a little bit about their practice. I think it's kind of always helpful, at least for me, to understand, you know, how's this practice like mine or different from mine, so I can maybe pick up a few tips from them. So we'll start with Forest Hills Pediatrics, Dr. Periard and Amanda Boyce.
Good morning. Thanks, Angie. Yes, Amanda and I are at Forest Hills Pediatrics, which is in Grand Rapids, Michigan. We are 12 providers with about 10,000 patients. So a patient size. Some of our providers are part-time, so an FTE wise, we're probably about the equivalent of about 9 FTEs. I have been with Forest Hills Pediatrics for 16 years and am the managing partner. And Amanda, I'll give you a second to introduce yourself as well.
Hi, I'm Amanda. I am a patient service specialist here at Forest Hills Pediatrics, and I've been around for about 3.5 years now. You're still muted, Angie.
Thank you. That's the, we decided that's the theme of, you know, 2021 is you're still muted. But next we'll go to Aimee Valenti. She is with Pediatric Partners. And if you would like to introduce yourself, Aimee, that'd be great.
Hi, everyone. My name is Aimee. I am the practice manager at Pediatric Partners, which is part of PediaTrust, which is a group of 13 independently owned pediatric practices in the Chicagoland area. And I'm happy to be here.
Great. Right, next we'll go over to MaryLou Marotta. She is with Allied Physicians. So MaryLou, you want to introduce yourself and your practice?
Hi, thank you so much, Andy. We are an 8-provider pediatric practice in Plainview, Long Island, part of, as you said, Allied Physicians Group. We're about, I think we're like 8,500 patients. Nice size practice. That's us, and we really enjoy Anytime.
Great. Next, we have Roger Hovis. Roger is in the nice, warm El Paso area. So, Roger, you want to introduce yourself?
Sure. I apologize. I dropped off the video. We went back to virtual learning with all the kids, and so it seems like the entire bandwidth of El Paso is being hogged up. So, but about myself, I've been with the practice almost 6 years now. El Paso Pediatric Associates was founded in 1910. I have not been here this long. And so we currently have 8 providers been signed on with Anytime Pediatrics since March of last year.
Great. Thanks, Roger. And our last presenter is Alyssa Scholz out of East Elm.
My name's Alyssa. I'm the office manager at East Elm Pediatrics in Pittsfield, Massachusetts. I started here not too long ago, back in March, probably the worst time to start a new job and career. But I'm starting to get the hang of it. So we have 1 practice privately owned. We have 4 providers in the office. We have a handful of patients, and our office is open 7 days a week, 8 a.m. to 8 p.m.
That keeps you busy, that's for sure.
Yes.
Great. All right, well, thanks everybody for introducing yourself. So we're gonna jump in with questions. The first one is really for Dr. Periard at Forest Hills. Can you take a little time and share with us kind of your daily patient flow and schedule and how that works at Forest Hills?
Sure. It definitely has been an evolution, to say the least. Going back to when we, to the start of the pandemic, we were doing some virtual medicine, but we were only seeing maybe 1 or 2 patients a month. But we quickly ramped up to a lot more and didn't really know how to do it. But we had provided walk-in services to our patients from 7:30 a.m. until 9 a.m. every morning. And it is something our patients really love. And so we really wanted to try to figure out how to continue that service, but obviously not have the patients walking in the door. So to do virtually, to do virtual walk-in or virtual on-demand. And so the physicians initially were very hesitant, of course. And so we have, like I said, had an evolution of our scheduling. When they were so hesitant, we kind of listened to what they'd prefer. And as you can see kind of on the left schedule here, there's kind of a green chunk that says walk-in. And then right next to there's an orange chunk that says virtual visit. So that individual really didn't want to just, have a walk-in scheduled in the middle of their day. They wanted it kind of buffered up against a possible scheduled virtual visit. So it allowed a little more of an opportunity to sit down with your computer, do a virtual visit, do another virtual visit, and then maybe go back to some inpatient in-office visits. Also, we had, and you can see the one column where there's a lot of orange and green. We had a provider who was higher risk, and so she exclusively did virtual visits. But again, we needed to be able to absorb the walk-in visit. So we tried to get an idea of how many walk-ins we were seeing during the winter. In real life, we would see 30 to 40. Our all-time high was 54 patients in a given morning per sick. And we really didn't know how many were going to be coming to us virtually. And I'll get to that later with some data we've been keeping. But initially back in March and April and May of last year, we were getting, 10 or 20 virtual patients wanting to be seen virtually and really trying to figure out how to absorb that. No one physician, other than the one who was home for health issues, no one physician really wanted to do it all themselves. So we kind of serpentined it, if you will, was the way we described it, where each physician would kind of on an hourly basis absorb one of these potential walk-in visits. And if it doesn't get scheduled, they end up with an opening and a time to just take a breath, which all of us have needed during COVID. So we've gone everywhere from, having larger chunks. Now the physicians are very capable and competent and enjoy kind of the interspersed virtual visit in their day. It kind of breaks it up a little bit. And they will take a walk-in just about anywhere, anytime of the day. But that really has been a evolutionary process. It was not something we could have done initially. There was a lot of what we are now calling context shifting, where you go from inpatient back to, in office to a virtual, back to an in-office. The physicians even asked for a 10-minute buffer in order to transition during that time. And so we accommodated that as well. So there was a lot of accommodations along the way. And honestly, keeping the physicians happy allowed us to successfully integrate telemedicine in this on-demand virtual walk-in type of way.
Great.
We did just get a question about if we separate our well visits from our sick visits. We do separate those out. We try to keep the virtual visits on more of a well side, just because, especially now, all the PPE that people needed to dress up and down for, we separated that out. Unfortunately, these slides don't show our separation from our sick side, but we did have those separated out.
Great. So Amanda, I think if you could describe, you described when we met last week, you guys really have kind of 3 channels that you're managing as the, the patient support specialist. Can you kind of describe those and the different channels you're managing in the front of the office?
Yeah, so I tackle, we started using a cell phone for people to text when they're in the parking lot. So they let us know first and last name of patients and kind of what they're here for. So we have that going on, and we have our anytime platform that we use as well. Those are the 2 biggest things that we use for that. Every once in a while, we will still get a walk-in, but we are trying to discourage people from just walking in off of the street for appointments or paperwork. We're trying to get all that communication ahead of time.
So you're the one person that manages all the patient flow, whether it's virtual or it's in person, they're all coming into you, correct?
Yeah, so we found that it's best. We have a couple of individuals that are up front with us, but we found that it was best that one person kind of streamlines all of that process at a time. Every once in a while, I might call on to somebody to make a call out if one of our patients are having a hard time connecting because they don't understand the process, or an email wasn't working right. So we make a call out 5 minutes before our virtual visits start, just to make sure that the patient feels confident in what they're doing for our anytime patients.
And do you feel like do you have a different mindset for your virtual patients versus your in-person? Do you manage them any differently, or is it, it's just probably the same reassuring comfort you do in person, you have to do via virtual visit?
Yeah, so we do use that chat feature here and there, just letting them know that the doctor's going to be with them, soon, letting them know that. For the text communication, again, we kind of have basically 2 letters is going to auto feed them a handful of sentences to get communication out to them, just because, again, we need to move fast. We're moving a lot of patients in and out of the building, at a time. So just, again, setting up whatever type of communication you want them to understand before they come in and out of the building. So, but I feel like, again, a lot of this has become standard, so they are pretty comfortable in using the text feature or using chat features on the app.
That's great. Thank you, guys. It's great to hear how dynamic it's been at Forest Hills.
And then I see another question here too about the form process. A lot of that is calling ahead. They call ahead to request certain information. So we will let them know if they are coming to the building, the phone number to communicate with before they come in.
So we tell them to arrive in the parking lot, text their child's name, and then just say they're here for forms. And then that way our patient service specialist staff can check to see that the forms are ready, and have been prepared accordingly. And then the patient or parent can just quickly come in the office, or we can quickly get the paper signed that they're looking for.
I'm curious if any of the other panelists have a different way you're handling forms, because I know there's probably a few different ways that could be handled.
At Pediatric Partners, we use a software that is for texting and sending forms out. So we've utilized that, as well as Epic has seemed to up their game, and that's what we're using as far as my chart functionality. And they are developing a lot of templates and questionnaires that we have been able to send electronically to our patients ahead of time. So that's definitely helped.
Great.
Yeah, if I can add to that, at our office, we have a patient portal through our EMR. So parents are just used to uploading their forms through that portal, and we send it right back through them that way. And that seems to work, cuts down on the people coming into the office. Because just like you guys, we're not allowing patients just to walk in.
Yeah, and I know from just to jump in there too, because I represent LIDA as well, but we use Frisia for pushing out those questionnaires. And so
Yeah. And we do the same texting thing with the, you know, on arrival, but we use Solution Reach for that, which is also a nice platform to have.
So in El Paso Pediatrics, we're using our patient portal. And for any well child checkups that are scheduled, we automatically push out the screenings using the Chattis platform. We've just recently integrated with them, and we're using it limited right now for certain ages and all new patients. So we've been successful with that integration since the first of the year. And then we're using the patient portal to send out any other documentation that is needed. Again, we're not allowing walk-ins for any reason. And so everything has to be scheduled, and anybody is stopped at the door by our screener. So we're trying to do as much of that external communication as possible.
Great. So Aimee, well, actually someone asked, has this been effective? You guys form different variances of forms if it's been effective for new patients. I don't know if you guys want to just throw it in the chat, one of the panelists. Aimee, can you tell us about the telemedicine workflow for pediatric partners, focusing on your scheduled appointments?
Sure. Obviously, it's been an evolution like everyone else. What worked on Monday doesn't always work on Tuesday or Wednesday. So we roll with everything. But what we try to do is we really try to mimic what we were doing in office pre-COVID. So however we're handling our patients that are actually walking to the office is how we try and handle all of our telemedicine as well. We make our appointments in anytime and in our EHR, so in Epic, at the front end, we collect or send any questionnaires, screenings, any administrative registration forms that need to be taken care of on the front end, to get them all set up so they're ready to go by the time the telemedicine visit time has arrived. When it is time for the visit, we send the patient over to our nurses to do the pre-charting or start the visit in our EHR. That has helped with the doctors expediting kind of getting right into the visit and the patient being ready for that, so that there's not a lot of time for the doctors spent. Is your video working? Is your sound working? Is your, did you send me that picture that we need? So that's been really helpful, sending the patient to the nurse. The nurse collects vitals, the chief complaints. If they do want pictures, has them upload them. So it's really made the time more efficient with the doctors to get all that information gathered at that time, and then also start the visit in our EHR system.
So your practice is now offering virtual walk-ins. How is that working for you? Do you have any tips for virtual walk-ins?
The virtual walk-ins we, like everyone else, had stopped our regular walk-ins, and that had become so popular and patients really loved it. We were doing it every morning and some afternoons. The virtual walk-ins, when we started them back up again, I was amazed at the response. I thought it would kind of be a slow roll, but it was immediately almost back to the volume on some days that it had been when it was actual walk-ins. We do that as on demand. So we have our system so that the patient can just call in and go right to the doctor. We have had to make some modifications, obviously, along the way, but again, we're trying to mimic it as we do an in-office appointment. So that's been the key for us, to try and keep all the ducks in a row, is just trying to not recreate the wheel for something, but making it as similar as possible so we don't miss anything along the way.
So are yours in certain time slots during the day, Aimee?
So our walk-ins are always in the morning. So we have 2 hours of walk-ins each weekday. Our other telemedicine visits, the scheduled ones, they can be sprinkled throughout the day. Some of the busier doctors that have filled schedules, we do have blocks around the lunchtime hour. That seems to be the most efficient time. to get them. And then later in the afternoon, kind of after virtual classes have ended, because sadly in our area, we are going back to school, but right now we're almost all on virtual.
We definitely see that it's around those virtual classes that you're seeing your walk-ins.
Yes.
Great. All right, MaryLou, I know you guys have had quite the evolution of growth over the last 12 months in your telehealth. Can you tell us a little bit about the experience at Pediatric?
Yeah. We've been doing telehealth here at PHA for a very long time. So we've kind of embraced the whole concept of it easily. I think we started with like maybe, I don't know, like 500 maybe in a month. Like that was like our lowest thing. We're now up to something like 900 to 1,000. We do it all day long. Also on demand, patients can request. We also used to also have walk-in hours, but now they do it that way instead. And it's all day long. So our hours are Monday through Friday. We do it from 8 to 7 p.m. all day long. And the weekends as well when we're here. So, it's always available to our patients. And I think that, it's really been a godsend during the pandemic, obviously, for obvious reasons. And, they were a little leery about coming into the office. So this kind of made them feel a little more comfortable, and they felt more at ease, I think. And knowing that they were always going to speak to one of their providers as opposed to, going to an insurance company site or something like that. So I think that's, really helped out a lot.
So MaryLou, since you're open all day for these telehealth visits, how do your clinicians feel? We know this is a practice manager, sorry, Barb, or Dr. Periard meeting, but how do they feel about people being able to kind of walk in all day for telehealth?
They've embraced it for the most part. They really have. We do our telemeds in conjunction with the wells and everything else. We have usually 4 providers on in the morning. So one provider is designated as the telehealth, sort of physician for the day, and the other doctors sort of pick up the slack of the overflow. And we schedule them every 15 minutes. And it seems to go well.
And does the 15-minute slot feel to your clinicians like that's a good amount of time? Is that,
for most things?
Okay.
For most things. I would say for like behavioral health issues where there's more conversation going on, those we allow the 30. They don't always use the full 30, but we allot for it.
Right. That's great. So I have a kind of to shift a little bit from your clinician adoption. How do your parents, MaryLou, feel about it? Did they, did they come kicking and screaming, or did they love it?
Let's just say I think it's grown on them. And I don't want to say it's been sort of shoved down their throat, but they really have embraced it. I think much better. Of course, you're always going to have the one or two who, for whatever reason, the technology end or that kind of thing. But I think they've really kind of adjusted to it, and they know that it's a good use of talking to the doctor and not coming in, because certain things obviously lend more, to a telemedicine and definitely the behavioral health aspect for sure.
Absolutely. That's great. It sounds like you're not only your clinicians, but your patients have all adopted it, which is great.
Yes.
So that's exciting.
So I'm going to take Alyssa for a moment. How is telemedicine working at East Elm Pediatrics?
Telemedicine is working really great at East Elm Pediatrics. Every department in the office is very happy with it. Our patients, their parents are very happy with it, that we offer this service with the high number of COVID cases in Berkshire County. They are very appreciative of the service.
How did your practice feel about, your clinicians in your practice feel about starting?
So a handful of providers wanted to go for it right away. The owner of the practice was a little hesitant at first, but he absolutely loves it now. He has days where he just telemeds all day for 8 hours. Every provider, they have their own chunk of telemedicine. So he probably wishes he started sooner because he is really a big fan of it.
Awesome. So you guys are in Illinois, right? So have you had any issues with billing for telemedicine?
We're in Massachusetts.
Oh, sorry.
No, that's okay. No. One thing I wanted to add that's great about telemedicine is because a lot of the parents don't feel comfortable coming into a doctor's office, understandable. We're able to keep track of our patients. Right now during pandemic, we see a lot of depression, anxiety. So we're still able to be on top of that and set up telemedicine for these patients. So it's going really well.
Do you have any advice for a practice thinking about telemedicine?
Yes, don't wait to sign up, just do it.
Nike, just do it.
Yeah, just do it. Don't hesitate.
I think for the most part, just about every pediatric practice kind of had to do it in March. And I appreciate our panelists because I feel like they're practices who have all, I think for telemedicine, it's been a learning experience for every practice, right? I think if there's, one thing I hope people walk away from today with, it's that every presenter on the webinar today has done some trial and error, right? Something they try in March may not work in August. And it really depends on clinicians and schedules and what's going on. So, I hope as a community of practice managers and administrators, we definitely learn from each other and continue to share that. Roger, I know El Paso Pediatrics was dipping its toe into telemedicine long before the pandemic. Can you tell us a little bit about your experience?
Yeah, I started looking at telemedicine a couple years ago for really chronic issues, helping college students away at school, trying to help them with their medication and follow up, and especially for asthma, ADD, that kind of stuff. But the doctor buy-in was really slow. And then our local Medicaid organization approached me to do a pilot program on a telemedicine platform. We actually went live on that pilot in January. It was a toy. We were only going to do 2 or 3 a day and to establish workflow and help them develop their product. Of course, when COVID hit, it was still a pilot program and it wasn't quite ready for prime time. And so we definitely needed something more robust that had more tools. And so thus we're with Anytime Pediatrics.
Great. And how do you, how's it going today? What kind of workflows do you guys use for telemedicine at El Paso?
So our schedule is open Monday through Friday, 8 to 5. We have 2 locations split between the 8 doctors. We are scheduling well child checkups and healthy child visits in the office. Healthy child would be stitches removal, x-rays, seems to be a lot of that lately. Then we would schedule telemedicine in between slots. We have virtual walk-ins for 30 minutes at lunchtime for the providers. All the providers sign on to cover those. And then we also do evening and weekend hours virtually.
Great. And your clinicians have handled it pretty well, Roger?
Yeah, most of ours really picked up the program and went with it. We do have one that's been with us over 47 years, and he's a little technologically challenged, I guess is a good way to put it. But we work around that.
Great. Yeah, I'm sure I saw a few heads nod. So I think there's probably every practice can identify maybe a clinician or a staff member who has had a few more challenges than other with the using of technology. So how have your parents in El Paso Pediatrics felt about telehealth?
Well, first we got a lot of pushback because they were used to their pediatrician doing a hands-on visit, and how can you look at a child's ear with telemedicine? But it's in our abundance of caution to protect the practice and the doctors for the future. We have definitely used telemedicine as a screening device. We just continually have that conversation And we're letting parents know this is not just a FaceTime visit. It's more than that. And so we still have a few that tell us that they don't have a cell phone or they don't have internet, but for the most part, they're getting used to it. Now it's been 10 months.
Yeah, absolutely. So as you look at, you were, like I said, an early adopter. What are some of, if you wanted to share with some of our newer adopters, what are a few of the lessons you might have learned in telehealth?
Well, today is a prime example. My video is not up because my internet is extremely slow. I've had 2 doctors in my office already complaining that the EHR is running slow. We went back to virtual learning today. Most of the schools in the El Paso districts went back. So that means our internet will be slow this morning. It will get a little bit faster at lunchtime. And then about 3 o'clock, when all those kids get free and go to their Netflix and their games, it'll drop again. So bandwidth was really an issue. We do have our local server for our EHR. So usually it doesn't affect the EHR, but it does affect all our email, our Zoom meetings, and definitely our telemedicine. So realizing that there is going to be technology issues was one of the biggest things we have to overcome. And we have an excellent bandwidth. Our service, I upgraded to a really good platform 3 years ago. It seems with COVID, we might need a little bit more.
Yeah, absolutely. I think that's something everybody's learned to know something about, is what's the bandwidth going into their office, and really how much that affects the parents on the other end, right? That's
Right.
that's a big challenge. So one question that telemedicine plays a part of, but isn't directly, but I think everybody can wonder how is your practice managing who comes into the office? How do you screen them or decide who's in office, who's not?
So anybody that's scheduling an appointment gets a verbal screening at time of schedule. If there are any symptoms or anything that we consider as a sick visit, it would automatically go to telemedicine. If it's we do in the parking lot COVID drive-up testing for an hour and a half each day. We did not want to be a drive-through site. That's not our business. But we wanted to be able to evaluate some of our patients if we thought there was a need to. So we only do that COVID testing for an hour and a half a day. But their only way to be tested is to have a telemedicine visit for screening. So if a child is coming in for a healthy child visit, like I said, stitches removal, x-rays, that kind of stuff, then they have a telemedicine visit first, and then the doctor will send a phone note to the nurse to go ahead and schedule the appointment in the office for a healthy child. So we do it during scheduling. A couple of days before a well child checkup, we also call, do the screening again, and then we do it at the door.
Great.
I tell my door screeners they're the gatekeepers. They're supposed to keep the barbarians out of the gates, and so that's my joke.
I'm sure Amanda can understand what you mean by that. So I think actually this is a great, that description, Roger, I think this is a great time for everybody, maybe some of our other panelists, to share kind of how they're handling COVID and sick screening. Because I'm guessing everybody maybe has a little bit of a different twist on it. So if anybody else has got some things they're trying in their practice, we'd love to hear.
Well, PHA kind of does the same thing that we just heard, that, for pre-COVID testing, we have everybody do a telehealth as well. So the doctors can assess exactly what exposure was and what the plan is. And then we bring kids in for testing too in this office, about an hour and a half every day in the afternoon as well. We don't bring them up into the office. We have a separate spot that we bring them up to, and the testing is done.
Right. I think, Dr. Periard, weren't you guys using a tent at one point at Forest Hills? I'm thinking weather has prohibited that right now.
It's a little cold out now in Grand Rapids. But we had a nice summer, and so we were going outside and seeing patients. If they have respiratory sick symptoms, we would see them in the parking lot. the others we would see indoors. As it's gotten colder, and I'll back up even because I think there was a question in the chat that I was in the process of answering about screening at the door. We would also, incoming patients, we would have an MA in our vestibule who would take their temperatures, ask them COVID screening questions. But again, this has been an evolution. We've had some time to develop some other means of doing this. And now that we send them a survey, if they're coming in for a wellness pre-scheduled reason, one of the many surveys they get, in addition to things like Vanderbilt's and ASQ's and things, is a survey that we wrote that is the COVID screening questions. And then when they arrive into the parking lot, they text us that they've arrived, and we make sure they've done that survey. And if not, we have a text, we have quick texts that Amanda uses and sends to the patient to confirm their COVID screening is clear, and we will allow them in the well side of our building versus the sick side. And then the MA meets them at the door and takes their temperature. So that has evolved as well. Our sick patients are redirected via text to the parking lot to park closer to the rear access, where they come in through the side entry to our building, and again are pre-screened. Most of the sick visits are usually scheduled same day because they've called and spoken to our phone nurses, and so our phone nurses screen them over the phone and put that and they have kind of some texted phrases that they answer and screen the patient that way. So they've been screened over the phone earlier in the day. We just confirm that they've answered the questions appropriately. But even if they are positive and one of their questions is positive, that they've had an exposure or they have a fever, obviously we are, like I was saying in the text in the chat, we are seeing sick patients. We do have some negative flow. We'll either see them in the parking lot, even though it's cold, or bring them into our negative flow room, which we only have one right now, but soon when they're done with our construction, we'll have 8 rooms that we can dedicate to seeing sick patients, which will have air turnover every 10 minutes.
We do something a little similar. We do, we also do telemed to screen everyone for a COVID test. Some of our patients were unsure whether it's COVID or there's something else going on. So they have a telemedicine visit, and then we have them come to our, we have 2 locations. So we've designated one location as primarily sick patients, end of day. So the patient will come to our sick office and they'll be COVID swabbed outside in the parking lot. And then if it is a negative result, we will allow them to come into the sick side of our office where we have air purifiers and a different setup where just the doctor in their full PPE will be seeing the patient. But we're finding more patients are needing to come in for ear checks and other things that are easier done in the office, obviously in person. So that's been working out really well, but then that does require sometimes 3 steps. So it's the telemedicine and then the in parking lot testing, and then they're coming into the office if the COVID test is negative. But that's been working out really well now that it is also colder in Chicago. We used to do those visits in the parking lot in the car, but just getting a swab is one thing, but spending 10 minutes out there struggling with a toddler in the back of a car is different.
I think the word evolution was well picked, Dr. Periard.
Oh, yes.
So, Dr. Periard, could you talk a little bit about the data you're tracking and how you use that?
Sure. I'm to be honest, I'm not sure how I use it yet, but my goal is to hopefully use it to continue to modify our schedule and plan accordingly based on how many telemedicine visits we may need and kind of the timing of them. This is kind of a more overview. I think I have it broken down into times of day as well, but trying to figure out how many e-visits at the start of the day. And back in March, we had 6 to 10 visits a day, and slowly it's been more like 3 or 4. An e-visit that is on our schedule at the beginning of the day is usually a follow-up of some sort, either a follow-up asthma, a recheck of ADHD, a recheck of anxiety, depression. So a lot of mental health, our patients are choosing to do it via telemedicine. Our asthma follow-up is as well. And then during the course of the day, how many patients actually get scheduled for an e-visit? So that is going to either be a virtual walk-in or on-demand visit, or something that the nurse might triage over the phone and schedule later into the day, but as a telemedicine visit by choice. So you can see back in March of April and May, when COVID was hitting us hard, we were scheduling, 6 to 8 additional sick visits. Sorry, I take that back. No, as much as 6 to 8 sick visits on the fly. We were not. Yes, we were. We were doing virtual telemedicine on demand then as well. And then now it's kind of dwindled down to anywhere between, usually about 2 or 3 a day that we will get as a virtual on demand request. And so you question, like, how do you set your schedule up accordingly? And what we've found is, again, this has been a work in progress as physicians have gotten comfortable with context shifting. It used to be that the physicians wanted a designated time slot, that this is the time that they were going to open up their computer, go find a quiet space, and go do a telemedicine visit. Now they're willing to incorporate that anytime where there might be a window. And so I think the question is, a patient, logs into Anytime Peds, they want to have a virtual on-demand visit, and you don't have any appointments available right now. Your schedule's full. And how do you bring that patient in who supposedly wants to be seen? And I can let Amanda address this a little bit, because we found that they're okay with not being seen this very minute. And so as long as we have 2 or 3, maybe I would say even 5 to 8 appointments available to absorb these patients. Some physicians might get lucky and get a 20-minute break, and other physicians end up with a scheduled patient. But as long as we have those appointments able to absorb these patients, it works. So Amanda, I don't know if you want to click on and kind of actually walk through what you experience as, working that front office position of scheduling these patients on the fly when they sign in.
Yeah, so that's just basically our hours for our virtual walk-ins, is basically the whole day from, 7:30 for the most part to about 5 o'clock. So at any point, we could have just a random one pop in. So I look at the day, we sometimes do have that segmented out where there's a virtual walk-in slot on a certain doctor, but if not, I just kind of look at the next available time and I communicate with them. Hey, does this time, work for you? If it's in another 20 minutes, I'll more than likely they're willing to just kind of hang out and wait on the app itself. If it's in another 40 minutes to an hour, I'll ask them if they want to stay or if they want to pop back in for that visit. And if they would like to come back in, I go ahead and schedule an appointment for them. So that way when they come in, they're not just requesting a visit, but they're actually going to their appointment time. So they see it right there on the screen. But yeah, you just kind of play around with it. You see what's going to work for your schedule and for that day.
I think just piggybacking on that, because I always say, don't look at telemedicine as any different than how you do an in-office visit. So how do we process, and we've been doing this for decades, right? How do we process a patient that calls right now and they're sick? You figure out where to put them in the schedule. So you kind of have your teams ready to understand where would you do the overbook or the squeeze in or what have you. It's kind of the same thing. You're not wanting to turn those patients away. And I also say that, this is our opportunity to get back some of the leakage with urgent care. What's more convenient than coming in through telemedicine to do that.
Yeah, we do the same thing. It's like the front desk takes care of all that. They just look at the schedule and, find a spot. And the same thing if the doctor's running behind, which, happens a lot, they just, chat with them in there and just move it down, accordingly.
And that's why I love the new feature that just came out where you can route
The best.
more than once, which is fantastic because we get that all the time. A doctor runs behind because of unexpected, sick happening, and now all of a sudden it's like, oh, well, I already routed that patient to them, but now it's like, oh, this person is available now. We can reroute.
So good. Yes.
Exam room shift, right?
Love it. Love it.
So one of the things I think quickly before we jump into questions, and I know we have a bunch, I think one of the things I think we've all learned is that I think this is going to be an interesting thing, like Leslie even said. I mean, this is just like any other care you're going to provide. And I think we're going to learn that it's going to be seasonal. It's going to be, it's going to change. And as we continue to share kind of some of this best practices with each other, we'll all get, better at what we're trying to do. So I think Tencel does have a lot of questions down there. Tencel, I don't know if you want to kind of tee them up to the panelists.
Absolutely. So we've answered some of them already. Do you see pediatric, adolescent, and young adult cancer patients, and how has Anytime helped them?
If I could jump on with something, originally when we started working with telemedicine, there was quite a bit of concern from the parents or even the providers of service we would be able to provide. However, we did have this is just a story. We had a patient who called in for a telemedicine visit. In the middle of the visit, one of our providers noticed something. So the process was started and cancer was diagnosed. And it was a great catch because it was early on, and since then the patient is being treated. So I feel that there have been some really great catches across the country because of telemedicine. Not only, but also because catches of abuse or neglect or depression, where lives and patient health have been improved because of telemedicine. I think it's. We just need to reimagine some of those visits and just look at it a little different. And so that patient we see with telemedicine, and occasionally they're seen in the hospital, but those are important things for us to catch.
I think it's also wonderful to see the home environment from a clinician standpoint. I think that's a pretty nice thing to see for them as well.
Yeah, I know a lot of our doctors share that with newborns especially, and the parents have a lot of questions, and they can show all of the crib, any of the spaces, and yes, it's taking you into a different window of that child's life than you would normally see. I know PHA also had a great story early on. This was they had a mother that was on bed rest, and being able to see the child, one of her other children, and then get the pharmacy to deliver the medication for the child. Like, she never had to leave the house. I mean,
yep.
I bet that mom was happy.
So I think, MaryLou, you did provide an answer to this in the chat. Anyone else want to talk about forms and documents that are used for a parent to sign and acknowledge the virtual telemedicine visit and that they've consented to the charge for the visit?
We have templates that we've built in our EMR that we use specifically for e-visits. And so we've also built into there that the patient has agreed to, to agree to a telemedicine visit, and it's just kind of written into our charting that way.
We're using the consent at sign-in with Anytime Pediatrics. And then I've also asked the providers to ask the same question and check it off in the EHR. Just a simple statement there saying parent has consented to telemedicine.
So a lot of questions around reimbursement. Did each of your Medicaid state plans already allow reimbursement for telehealth? If not, what plans do you all have long-term if the temporary reimbursement through the state-funded and private insurance plans end when the state pandemic state of emergency is removed?
Our local MCO really jumped on quick, and they've been very supportive. And I know we're all concerned about what's going to happen when the pandemic ends, but I patients and the private payers have realized for a long time that telemedicine was a way for them to reduce the cost of medicine and make it more convenient for the families. Our highest no-show rate is with Medicaid patients. There's a less no-show rate with telemedicine because a lot of times, did their car start? Did they have a flat tire? Did they miss their bus? There are a lot of reasons why some of the Medicaid patients can't make it into the office. So I think that, let's see, how many of us were surveyed in the for 2 years now? Are you providing telehealth or telemedicine platform for our patients? They knew this was coming in one way or the other. It just was forced to the front of the line by the COVID.
And I will jump in and say that for anybody who's in a state that they're worried, I think a great resource out there is the Center for Connected Health. Tencel, we can probably put in the chat their website. They are a national agency broken down by area that really tracks telehealth reimbursement, Medicaid and private payers, and the different laws that are there now and laws that are proposed and when they're changed. And because they're, by geographic regions, you can find real experts on your state. I can tell you, I know they've just started a webinar series every Friday afternoon, but I think they're a great, not only resource to know what is applicable in your state, but I think they're also a great resource to help change legislation in your state. If you are in a state that doesn't have parity or you're worried about Medicaid payment, after the pandemic, they're a great group to get involved with to kind of help be a leader for change.
I agree. Get all of your doctors around you, advocating. It is a great website.
Yeah. They really, I really haven't found a better site for more data on kind of reimbursement and payment and Medicaid and things like that. So I strongly encourage you to take a look at that, even just to keep up with what's being passed in your state.
Great feedback. It looks like Dr. Periard might be typing an answer, but we'll also position it to the rest of the panelists. If a patient has a telemedicine visit in the morning and the clinician requests the patient to come into the office that afternoon, is that in-person visit attached to that same virtual visit?
Yes.
Perfect. That's the one I was typing. So I will just give it to you in person. Yes, it can only be one visit. You can only have one visit on a day, but the way we do it is it may even be a different physician. Unfortunately, we are very team oriented around here, and we really don't care who is the billing physician of record. But the originating physician who did the telemedicine visit, we have some templated text that we will just cut and paste into the note that says, my visit ends here. I determine this patient needs to be seen. And then the patient comes into the visit. The second physician, or possibly the same physician, will open that same note and then say, my visit begins here, and here is my assessment and plan for this child. Usually you can obviously upcode it in terms of, and then it no longer is a telemedicine visit, it's an in-person visit in terms of coding. So that's how we do it in our office.
We do the same.
And I see you did respond to this, Dr. Periard, but I've heard some great feedback from MaryLou on this recently and would love to hear from other panelists. How do you manage technical difficulties or user errors with the app? And Dr. Periard says that the instant invite feature is a great way to overcome some of those issues. But any of our other panelists want to provide some feedback there as well?
I think personally that it's very important for whoever's maintaining the programming. In our case, it's our front desk. And I think that's helpful to the physicians. They sort of troubleshoot any problems and they know how to get around them all. If any parent is having a problem, downloading, putting the practice code in, I mean, we don't have a problem just going in and entering it ourselves. And it just sort of saves us a little step in the middle, and we know it went in.
Yeah, we actually wait about 3 minutes before the appointment time. And if they're not in there, we will actually call them ahead of time just to see if they are having any issues.
Yep.
It also helps with if someone forgot last minute that they even had a visit. I actually helped someone who was just finishing up their shopping trip get on because they had forgotten about their virtual visit that they scheduled. But we will call and troubleshoot with them over the phone. I know Anytime has sent out a handful of items to help kind of guide people as well. And so we just give that feedback to our patients, but we definitely give that call out. And then we also try to check to make sure if it's like a rash that they have uploaded photos right on Anytime, because those are really helpful for the doctors to see.
Yep.
The front desk has been amazing. Scheduling those appointments, filling the slots for the doctors, keeping the doctors busy too. Forgive me, Dr. Periard, but sometimes you just don't want a doctor in your office, right? So, and then following up with the patients who are having technical issues, just getting them to go in sometimes and put our practice number in. It's just, they've been really supportive, and as a team effort, it just makes it a successful project.
Have you moved all of what used to be phone call questions to telehealth visits?
I would say a lot.
That's a great question. We have not yet. We've considered it.
We do.
With business being slower.
We kind of make almost hardly any phone calls go up for the physicians. They're telemed visits. Unless it's a formula question for a newborn or something like that. Anything that has any kind of conversation involved, we make a telemed.
And we are at the top of the hour, so we'll take one or two more questions. Any thoughts on how to drive more patient volume to telehealth?
Well, all of those medication follow-ups, anything that you would normally schedule every 3 months or every 6 months, just tell them that we're only doing it on telemedicine and just making it part of the new process. And I'm sorry, COVID is making us do this. For those people that say, well, I've been coming there for 50 years and you've never made me do this before.
It's training the behavior you want, right?
Exactly.
Yeah, that's what I was going to say. It's all about that patient communication and patient education. That's the biggest thing, because I haven't had too much pushback about the virtual visits. A lot of people actually really enjoy it because, again, what healthy individual necessarily wants to come into a doctor's visit when it's not really necessary?
Great feedback. And Angie did provide the Center for Connected Health Policy website at cchpca.org. So check the chat for that link. Last question, and then we will let you all go for the afternoon. Do you use telemedicine visits for lab and imaging results?
Yes. Especially lab.
Yeah, lab too.
Wonderful. A lot of great resources, a lot of great information and ways to use telehealth. Thank you to all of our panelists for joining and providing such great insight today. Thank you to our attendees for hopping on and asking great questions. We will be deploying a poll. So if you will share a little bit more information as you exit today, we hope you have a wonderful Thursday afternoon, and thank you again for joining.
Thanks,
Thank
everybody.
you.
Thank you.